Welcome everyone. We just wanted to have a quick little conversation about the differences between the CPC, the COC, and the CIC exams. This is a question we get really frequently. So we put together a little comparison table here to go through the differences with you. The predominant difference between the CPC, the COC, and the CIC is what environment are you working in? If you are doing the CPC exam, okay, that stands for Certified Professional Coder. When we talk about professional, we're talking about you're typically doing coding for a physician or another qualified healthcare provider, like a nurse practitioner, physician assistant, but you're actually doing the billing for the physician. For both the COC and the CIC, you're typically working for the facility, the hospital, that type of thing. And the difference between those two is what part of the hospital are you coding for? Are you coding for the outpatient? If so, you're looking at the COC, hospital outpatient side. Or if you're coding for the inpatient facility, you're looking at the CIC. We talk about inpatient, we're talking about those patients that are admitted for an overnight stay or oftentimes longer than that. Outpatient, think emergency room, think same-day surgeries, even some of your PT, OT, speech, laboratory and pathology services, those types of things, where you might go to the hospital for a procedure, but you're not kept overnight. You get to go home same day. That's the biggest difference between these three. This grid that we've got up right now also shows you the difference in the exam content. So, for example, for the CPC is completely multiple choice, totals 150 questions, and the questions are divided up amongst the categories listed here. So there are about 60 questions across the surgery section of CPT, or the current procedural terminology. There are 10 questions on evaluation and management, 8 on anesthesia, 10 on radiology, 10 on path and lab, 10 on the medicine section. There are 16 total across medical terminology and anatomy. There are 10 that are exclusively on ICD-10-CM. There are at least 5 questions all about HCPCS codes and modifiers. And then there are some questions on the coding guidelines and some of the compliance and regulatory things, the basic Medicare questions, that sort of thing. Those are all of the areas on the professional side, because that's what you usually have to know to code for a physician. The COC, you're going to notice that it tests on all of those same areas, right? These are matched up, or row for row. So what they do is they decrease or increase the number of questions in some of those categories. Anything that's in light green, they've cut back the number of questions. So surgery cases, instead of 60, you're only going to see 40. These other areas of CPT, instead of about, I think, 58, you're only going to see 20. But they're going to increase the number of questions in this middle color green. So there's a couple more questions on MedTerm, a few more on anatomy, a whole bunch more on diagnosis coding, right, your ICD-10-CM, and about double the number of questions on HCPCS. Instead of 5, you're going to have 10. They ask one less question on coding guidelines, the same kind of information on compliance and regulatory, but down here in the dark green, they ask brand new questions that they wouldn't ask on the professional side. And these are all about payment methodology, because if you're coding for the facility, you need to know what kind of facility you're working in and how they get paid. Right? There's different prospective payment systems depending on the type of facility you're coding for. So they're going to ask you about 20 questions all around payment methodology. The overall exam for the COC is still 150 multiple choice questions. So it's extremely similar to the CPC. And actually, if you look at most courses, the first part of the course is the same information that you have as the CPC. The difference is now we're going to give you a bunch more education on payment methodologies so that we make sure that you understand that the payment is different. And they're also going to test you on a little bit different surgeries than you would see from a professional provider. Your CPCs, right, those doctors could be anybody and they could be performing just about any type of surgery. Well, the hospital outpatient only allows certain services to provide outpatient, right? Like, you're not going to do a bilateral lung transplant in the outpatient side of things. We're not going to replace their lungs and send them home that day. That's not how it works. So that's not a case you would ever see on this exam. It's going to be specifically geared towards surgeries that are typically provided in an outpatient unit, or procedures that are typically provided in an outpatient unit. So it's kind of different than the professional. Those two credentials are very, very similar, however. You'll notice all of the categories are the same. It's just the number of questions that they're asking. The third credential that we're going to talk about briefly is the CIC. That's the inpatient hospital. Now, this credential is completely different than the other two. I won't say completely different. Some of the areas are a little bit similar, but it's different in structure and it's different in content. Instead of 150 multiple choice questions, there are 60 multiple choice questions, which are all of these first categories, except for this very bottom bright green box. Okay, those all total 60 questions. But this very bottom box says that they have coding cases. These are not multiple choice. These are fill in the blank. And they average, according to the AAPC, about 110 codes across those 10 cases. So one case may have 12 codes, one may only require 10 codes. Just depends on which case you're looking at, because you're coding both diagnosis and procedure codes. But you're not, the other big difference, you're not using any CPT codes. See, that's completely blank. There are no CPT codes in the inpatient facility side. Instead, you're using ICD-10 PCS, so it's a different code set. They do still ask you about med-term and anatomy. They talk about ICD-10 CM diagnosis coding. They ask you questions on compliance and payer regulations, payment methodologies, just like they did on the outpatient side. On the inpatient side, they ask you about payment methodology. Some people ask me, well, why do they ask about outpatient payment methodology? Well, you need to know both of them if you're working for a facility, because if you're working in the outpatient side, what happens if you have a patient that becomes an inpatient? Same thing, if you're working on an inpatient side, what if that patient started out on the outpatient side? Does it affect how you get paid? So they ask you some of those basic questions. There are two new categories for the CIC as compared to the other sections. Not that you don't have coding cases on both the CPC and the COC, but for the CIC, these are completely fill in the blank. The other two exams, they're multiple choice. So that's a huge difference. The other area that is different for the CIC is instead of focusing on coding guidelines, now they're asking you about medical record documentation guidelines. You know, how long does a provider have to make a correction in a chart? How do they make that correction? Are there certain protocols that they have to follow, and what does that have to look like, and all of that? So those two areas are significantly different than the COC and the CPC. So when we look at these three credentials, the biggest thing that you need to know as you're looking and trying to determine which one is for you is CPC is geared towards those that are coding for the physicians and the other qualified providers. Okay, you're on the professional side. The COC and CIC are for the facility. You're working for the hospital usually. And the difference there is COC, you're working in a hospital outpatient department. Think emergency room, same-day surgeries, outpatient therapies, that sort of thing. Where the CIC, you're coding for the hospital for those patients who were there for an inpatient admission. They were usually there several days, major surgeries, they may have had an infection, those types of things. So the services are a little bit different. That's kind of a baseline of the difference between these three. If you want more information on these credentials, go out to the AAPC website. You'll actually find that they give a listing, just like we do here, of the breakouts of how many questions in each section. And if you click on those breakouts, it'll give you more details on, okay, when we say HCPCS Level 2, here are the types of questions we might ask you about. We might ask you about modifiers. We might ask you about medications. We might ask you about Medicare-specific procedure codes. But I hope this kind of gives you a high-level overview of the difference between the CPC, the COC, and the CIC as you try to determine which credential's right for you. Thanks and have a great day.